You go up for a rebound, or push off for a sprint, and there it is, a sharp, highly localized spike of pain, right at the bony base of your kneecap, hitting the exact moment you absorb the landing. This specific sting indicates jumper's knee, a condition where extreme mechanical strain concentrates on a single point of the patellar tendon, distinct from general muscle fatigue. Because this is a mechanical overloading issue, simply resting on the couch usually fails to fix it. The moment you return to the court, the stress returns. To actually recover while staying active, we have to physically alter how force moves through that specific point on your knee. The infrapatellar strap functions as a precision tool, designed specifically to alter the physical geometry of the knee joint. This computational heat map illustrates the results of that intervention. Without a strap, a high-strain red zone concentrates at the base of the kneecap. With the strap applied, that localized strain drops by up to 34%, shifting the region into the green and blue. By the end of this video, you will know exactly how to trigger this pressure drop, applying the strap perfectly to create a protective shield for your active rehab. To prove how this works, we look at a 2011 computational analysis, mapping the precise internal changes inside the knee when a strap is applied. These clinical X-rays show the first major mechanical shift. When the strap presses into the soft tissue, it increases the patella-patellar tendon angle. At the same time, this inward pressure functionally shortens the working length of the patellar tendon. This schematic visualizes the forces at play. As the strap pushes inward, displacing the tissue, it creates a rotation at the bone, shifting the mechanics of the entire joint. By forcing the joint into a wider angle and creating a shorter tendon, the strap successfully neutralizes extreme tension at the bridge of the kneecap. Note that this immediate drop in pain is a mechanical bypass. It is not a biological cure for the cellular damage present in your tendon. Real tendon healing requires strict, heavy, slow resistance exercises prescribed by a physical therapist to rebuild the tissue's capacity. This makes the strap a temporary shield. Its true clinical value is lowering mechanical strain enough so you can perform vital rehab exercises completely pain-free. Feeling less pain while wearing the strap does not mean you are cleared for max effort sprints or box jumps. The underlying structure must be rebuilt. Let's lock in the exact application method to guarantee those geometric changes. Step 1. Sit down and bend your knee to roughly 60 degrees. Step 2. Physically trace your fingers down your kneecap until you find the bony tip at the very bottom. That is your inferior pole. Step 3. Place the padded section of the strap immediately below that bony tip, so it rests entirely on the soft tendon, not the bone. Step 4. Tighten the strap. It needs to be snug enough to press inward and alter the tendon angle, but it should never cause pinching. Step 5. Run the two-finger test. Slide 2 fingers between the back of your knee and the strap. If it pinches, it's too tight. Perfect placement triggers the geometry changes we saw in X-rays. If it slips down your shin or rides over the kneecap, the tool becomes useless. Once the strap is locked in, stand up and perform a light bodyweight squat. You should immediately feel a reduction in that localized strain at the bottom of the kneecap. Moving forward, you need to track 2 daily metrics: your subjective pain levels during movement and the physical stability of the strap's placement. If the strap slips down during a workout, do not just pull it tighter. Stop, loosen it entirely, and take the 5 seconds to rebuild the correct placement from scratch. Tracking your pain ensures the strap is handling the excess strain without accidentally masking severe structural damage that requires medical intervention. There are strict red flags to watch for. If you experience tingling, numbness, or coldness in your lower leg, remove the strap immediately. Anatomy varies, and in rare edge cases, a strap can compress an irritated fat pad. If sharp pain actually worsens despite perfect placement, stop using it and consult your doctor. By shortening the tendon and widening the joint angle, these straps physically reduce the tension that sustains the persistent ache of jumper's knee. This strap is a scientifically proven biomechanical tool. Use it precisely, commit to your rehab exercises, and take control of your recovery.